So the majority of the people in this room are sellers, what we call in the Free Market Medical Association sellers. People who are in the trenches providing care, whether it's an imaging center, a surgery center, a physician's office, physical therapy, occupational therapy, you fill in the blank. And so the next two speakers are going to be talking primarily to that subset of our guests here today. Now, that's not to say that the employers are going to be left out of the conversation. We got something for you too, okay? So I'd like to introduce Dr. Phil Boucher. He is a direct primary care physician here in Nebraska, and I took a real quick peek at your slides. I'm not going to give anything away, but I'm very excited. Thank you.
Thank you. The font, if you're wondering, is called Bold Procrastination, and this is how I usually end up doing my slides. Is just handwritten, and actually people are like, "What font is that?" Like, yeah, it's my own handwriting. Okay, so I get to talk in front of a lot of different crowds and about direct primary care, about practice marketing, about a lot of different things. The toughest crowd actually is twice a month on Thursdays. I get to go to my kids' school and talk science. And what I have found when talking with 5-year-olds through 12-year-olds is if we start with some movement, then everybody is more attentive and they are more engaged and they're less fidgety. And so to that end, I want everyone to preserve their energy this morning by standing up and just stretching for a moment, and then we'll get started. We do Simon Says, but I won't make you guys do Simon Says. I'll just kind of tell you, to stretch your bodies and move for a moment. Gosh, you wouldn't believe how good kids are at Simon Says and how difficult it is to get a room full of 6-year-olds to actually lose at Simon Says these days. They're very attentive and they know what they're doing. Today I'm going to be talking about direct primary care from my perspective as a physician and from the perspective of my patients and families. I would love to understand who everyone in the room is. I know Dr. A talked about it a little bit, but how many people are healthcare providers, physicians, PAs, work in the healthcare space? How many are employers? And how many are patients? And so on that note, everybody interacts with healthcare on a regular basis. And how many people, more often than not, have a good experience with healthcare? More often than not, have a good experience with healthcare. Okay, well that's reassuring. Actually, I was expecting 0 hands, so it's nice that some people do have a good experience with healthcare on a regular basis. What I'm going to talk about today, my talk is titled, "That's Not the Way It's Always Been Done." And that phrase right there is why I'm in front of you today, is because as a physician, I grew up in Nebraska. I went to the medical center. I did my pediatrics residency at Children's. I went back to Lincoln to practice in my hometown, and I kept hearing this phrase, "That's not the way it's always been done," so often that I said, well, why can't we do it that other way and stop doing it the way it's always been done? Because the way it's always been done, I think we've learned this morning and over the past years, it doesn't work for everybody and it doesn't work in the long term. I started my pediatric direct primary care practice in 2021 as the state's first pediatric direct primary care. Luckily, there were a lot of forefathers and physicians that went before me in our state that started family practice direct primary care practices that I could learn from. Some of them are here today. But what I did was I said, okay, I've been in private practice for 8 years, very successful private practice owner. I can't keep doing this for the rest of my career, and I can't keep providing the care that I'm providing and sustain that for myself, and it's not fair to my patients and the families that I take care of, and it's not fair to my own family to continue providing the care that we're able to provide within the insurance-based system. And so that led me to say, well, there must be something better out there. And learning about direct primary care was a career changer for me. And I've gotten to, since I started my practice, speak at a lot of different events about direct primary care and help others, physicians, to realize what this model can offer them, whether they're in primary care, whether they're in specialists, whether they're a surgeon. There's a route that allows you to escape from the complete fee-for-service monster that we heard about just a little bit ago. Just really quickly to recap, I'm going to leave a lot of time for questions at the end, but I just want to kind of briefly outline what direct primary care is. So direct primary care, the word direct essentially means you interact from a financial standpoint directly with the patient. Now, you also interact with them on a much more regular basis as their clinician, but direct primary care means that there isn't the insurance middleman that's getting in the way. It's typically membership-based, meaning if you think about your gym membership, if you think about your Netflix membership, you're allowed to use those as often as you like within the confines. I mean, you can't go to the gym at 2 in the morning if the gym is closed at 2 in the morning. But it's membership-based, meaning that you pay a monthly fee, and in exchange, you get a certain amount of health care provided without having to worry about copays, deductibles, or if I ask a question, or if I need to go in to get something checked, that I'm going to get an extra cost associated with that care. What that does, we heard in the last talk about the number of administrators that just deal with insurance denials. There's insurance interactions, not just the denials, but all of the things that relate to insurance care that really raise the price and overhead for an office. With the membership-based model, the overhead is much lower, which allows us to charge lower rates and provide more care with fewer employees and fewer ongoing expenses. With that, we're able to offer a higher level of care. So my patients have unlimited visits. We take care of babies. Sometimes parents just want to bring them in to get their ears checked, and then 3 days later, they want to bring them in to get their ears checked again. Instead of, here's your copay, here's a bill 3 months later, they just come in. They book an appointment and they're able to come in and get their ears checked. And then unlimited access too, and that can vary. Sorry, I don't know why I'm shining mine at this one. You guys aren't looking at the screen. I'm looking at the screen, but I keep shining it right at him. Unlimited access, which for us looks like text messaging. Parents love to text. They don't like to make phone calls. How many people love waiting on hold and making phone calls? Parents want to be able to say, hey, is this rash normal? Or hey, my kid has a fever. Or can you take a look at this baby poop? Is this normal? I mean, you would be amazed at how many baby poop pictures we get every day where it's, okay, does this poop look normal? Does this poop look normal? Does this rash look normal? All those different things. We're able to offer that because we're not tied to, well, if your baby's poop looks weird, you better come in and take time off work and wait in the waiting room and pick up another illness in the waiting room and then wait in the room just to have me, look at the poop. Or honestly, usually it was just look at a picture of the poop and your baby looks perfectly fine. That'll be the copay, the co-insurance, everything like that after the visit to be told, yeah, your baby's poop is normal. Instead, it's just a quick text message. It's a little bit of zooming in on the poop. It's like, okay, let's move on. And then less friction. So instead of having layers and layers of people to talk to as the patient, you're able to interact much more closely with your clinical team, people that know you and know the specifics of your health conditions and the context of your life, the things that play a role in your health outside of the prescriptions that you're on and your past medical history. I think we're at the moment where there's a pendulum swinging. And so if you look up here at the top, you can see the doctor from Little House on the Prairie and Marcus Welby and the home visits and the personalized care. We swung to such an extreme that there were pods at the mall where you could go in and not talk to anybody, like face-to-face, to get care, and that company Forward just closed because the model didn't really work and it didn't provide good care. People realize there's a difference when it comes to my healthcare if I'm just going into some enclosure at the mall to get my prescription for my sinus infection. And now we're swinging back to personalized care and relationships again. This is not my usual attire. This was me on Halloween going to do a home visit. So I was dressed up as Anxiety from Inside Out, thank you. And so I was going to do a home visit. We do home visits for our newborns. So parents have their baby, they go home from the hospital. Instead of packing baby up, coming and waiting in the waiting room, needing to feed, all of those sorts of things, parents go home from the hospital and we say, we'll be out tomorrow morning. Do you need a coffee or anything? They always need coffee. And stop by their home, weigh their baby. If we need to check their bilirubin, we poke their heel, take their blood, take it to the lab, all those sorts of things that we're able to do And I mean, I wasn't sure if parents would actually like that, because I think for me, it would be, oh, I don't really want to come over, we didn't clean up, we just had a baby, all those sorts of things. No one has ever said, please don't come over, my house is too messy. Everybody likes not having to leave their home right after having a baby. And so that's where we're at with the pendulum swinging back towards relationship-based care, where people feel known and heard, and the specifics of them are honored in their healthcare decisions. We really lost that human touch when it comes to medicine, which is what happened with this pendulum swing, and people can feel it. People can feel that there aren't those interactions, that they're going online and filling out a form and getting a prescription based on that information, and it doesn't feel like anybody knows me or honors me or understands why I'm doing what I'm doing or why I'm seeking out support and help, because it has been automated and turned into chatbots, and the Amazonification of healthcare just isn't working for patients these days. And so when we talk about primary care in particular, there's a lot of challenges that we face right now. In addition to a huge shortage of primary care physicians in our country, the volumes keep going up, which leads to more referrals, because if I have to see 30 plus patients per day, I can't sit there and talk through the specifics, so I'm gonna send you to somebody else, a specialist that can, which raises the cost of healthcare, it fragments healthcare, it slows healthcare, and what then happens is we get more labs, we get more medications, and we get more imaging to try and compensate for that high volume. We lose continuity because we're seeing 30 patients a day and we're booked out 3 months, so if you have a specific healthcare need, you're gonna have to wait, or you're gonna have to go to urgent care, and there's not gonna be any continuity there. And it leads to worsening burnout, which already before the pandemic was a huge issue that we were talking about. In the 2010s to 2020s was really when I think a lot of healthcare systems started their wellness committees, and to try and figure out how can we help our clinicians who are burning out because of the volume, because of the referrals, because of the care. And then the pandemic just lit that on fire, just poured gasoline on the fire of where we're at with primary care and with specialty care. And on the flip side, patients are wanting more convenience. They want more convenient options for their care, because how many people here are too busy? Well, all of us are too busy, right? There's increasing levels of distrust. There's the effect of influencers and social media on our healthcare experience. There's an increase in illnesses and chronic diseases, and there is less connection and relationship. So you continue to feel like a cog in the wheel, and when you talk with somebody at your doctor's office, they're just more interested in what your insurance number is and your medical record number and all these things, and it just doesn't feel like you feel personally understood, and the challenges that you're facing are being taken into consideration. And so what direct primary care does is it solves for the ones of these that are solvable. I don't think we're gonna have any big impact on the influencers. We can improve convenience, so patients are more likely to turn to us when it is convenient to them to turn to us. We can decrease distrust by having those relationships. In direct primary care, we're able to have lower volume because we have lower overhead. We're able to save referrals when we can. I can take a look at that. Let's try this first before sending you to the dermatologist or the endocrinologist. I have the time to sit and talk through that with you so that it isn't, let's just send you to somebody else. Their waiting list is 3 months, the illness gets worse, you end up in the ER or something like that. We're able to decrease the cost of labs and medications by having enough time to talk with the patients and figure out what they really need. Some offices, like Todd Johnson, who's in the audience here in town, his office offers medications in their office. So instead of the high cost of going to the pharmacy and the pharmacy benefits managers and all those things, you can get your pills directly from his office, so that the cost of those medications is dramatically less. It improves continuity, and it solves for burnout in a major way, in part by all of these things, but also creating that connection and those relationships that people and clinicians are really craving. And so in DPC, we have, like I've said, lower volumes, increased appointment length, improved connections, and it improves outcomes. And fortunately, we're so far in now. DPC really started in the early 2008, 2009 era, and we've had enough time to get a lot of data on it, and it improves outcomes for the patient. It improves outcomes for the family. It improves outcomes for employers who partner with the direct primary care practice to care for their employees' healthcare, and it improves outcomes for the clinical team. And so when we talk about patients, they get the improved access. They are working with a smaller team, so they have a bigger connection and a deeper understanding. I can tell you in our practice, when we're talking about patients, we're not talking about them by their last name or their medical record number or their date of birth. We're talking about Liam and Scotty and Rosie, and we know our patients by their first name, and we know who we're talking about, or there's enough surrounding context about Rosie's soccer game last night. She fell and hurt herself. I'm like, okay, I know who that is. I know exactly who they are. It decreases ER visits, referrals, and unnecessary tests, and it's more affordable and predictable. How many people can predict how much their healthcare is going to cost in the next 6 months? Most of us can't, right? We have no idea. Whether we're sick or whether we're well, we go into the doctor, we have a stuffy nose, or we're worried about a mole or something like that. We have no idea how to predict. In direct primary care, my patients know exactly what their healthcare is going to cost next month, and next month, and next month, and so they can budget and plan accordingly without having to worry that there's going to be something catastrophic, like an ear infection that they have to go in twice, and then they have to go in a third time to get their ears checked, and they get a bill for $700 for 3 ear checkups. That was 3 months ago now when they finally get their bill. It's predictable costs for healthcare. For families, it increases their peace of mind. For people that, for loved ones, older loved ones, knowing that that my older loved one has a care team that knows them and checks in on them on a regular basis makes a huge difference for those families. And they serve as a point of contact to make it easier to navigate our healthcare system, which is complicated no matter where we're at. For employers, it decreases the cost of care. You heard from the speakers before this about the increasing cost of care. What employers can do is work with the direct primary care practice to say, hey, we're going to have our employees have access to this direct primary care practice. And in doing so, we know that there's a standard amount of care that's provided. We know that the access is improved. We know that our patients or our employees will feel well cared for. They'll be able to get back to work faster and feel like somebody cares about them enough to say, hey, we want to make sure that you have a good healthcare experience. This is that important to us, and it saves us a ton of money too, because we're able to reduce the cost of healthcare for our employees by working with a direct primary care practice. And then for clinicians, talking again about decreasing burnout by improving the time that we have with our patients. We're able to enjoy medicine more by focusing on the care rather than all of the administrative burden that gets in the way of enjoying medicine. We're able to focus on our passions and our interests. Something that I'm really passionate about is neurodiversity. And so what that looks like is I get to do autism evaluations, which I could never do in a regular practice because insurance just doesn't pay enough to justify the time it takes to do an autism evaluation. But that's something that I am able to do. And holistic ADHD evaluations. Those are things that I wouldn't be able to do within the confines of a typical fee-for-service practice because they just take too much time to actually do well versus what you would get paid for a clinician's time for doing that. And it improves our relationships with our patients. I have more time with my family. My staff have more time with their families. We all feel so much more peace and fulfillment and unrushed in our day-to-day lives. The cost of healthcare is out of control, as we know. Oops. There's lots of studies now looking at the impact of direct primary care. There's nothing that's going to be super surprising here that direct primary care saves money, that healthcare is expensive, as we heard in the last talk, that costs for reduced emergency room visits, reduced inpatient expenses, lower specialists per member per month, and decreased home health and ambulatory expenditures when direct primary care is utilized for individuals and for employers. Healthcare lags in tech advances too. How many people know that your doctor's office still faxes the vast majority of communications? Like, that is still the standard, is faxing documents. And I know that there's people here that work in healthcare offices, and you know exactly what I mean. Like, the faxes come in, somebody has to manually go and like look at them and try and figure out, because it was a fax that came in, who is this for, and then assign it to a patient's chart. It is so time consuming because technology has lagged so far far behind. With direct primary care, and we're able to do a lot of care over text message. We've looked at the numbers, and about 70% of what would have typically been, okay, you gotta come in, we're able to take care of completely from question to reassurance or advice over text message without having to have them take off work, without having to come into the office. And then what we do is we check in the next day. Hey, you know, how's baby doing today? We're able to do that over text message easily and provide really good evidence-based care without all of the trips to the office and the missing work and the waiting and the waiting and the waiting. We're able to do video visits. Another way that we lower our overhead is online booking. How many people would prefer to book online rather than call and, you know, play calendar tag, you know, with the receptionist? We use AI scribes. That's another way that we're able to focus on providing a good patient experience is when I go into the room, instead of, okay, what brings you in today? Perfect, okay, and when did your fever start? Okay, let me write all that down. AI scribes is a great way to, they listen in, they create the note. I can focus on looking the patient in the eye, understanding them, and it picks up all the things that I said that I was gonna do that I would have forgotten about. And so there's so many technology advances that really DPC solves for. So when I think about direct primary care, I think about the Marcus Welby of, you know, going to the home and knowing the family deeply and personally, but then I think of him with a cell phone that allows him to stay at his house or stay with his family more and have the meshing of the personal, the relationships, the connection paired with the technology that, you know, everybody is very used to today, and healthcare is just very slowly catching up and holding on to those fax machines with our cold dead hands. And so it's not the way it's always been done. It is a new way, and what I think direct primary care and direct care in general shows us is that it doesn't have to be so hard to provide good care and to make it affordable for families and also very fulfilling for the clinicians. And so with all that, I would rather than just keep going on, just answer questions, because I'm sure it's generated a lot of questions about how could this be possible, or how do you do this on a day-to-day basis, or what does that look like? So I'll just open up to questions, and if there aren't any, then we'll just play Simon Says. Yes.
So you talked about how, thank you. You talked about how direct primary care saves patients money, saves the employers money, allows you to spend more time. But how, as a physician and as a business owner, do you keep the lights on
Right.
and feed your family when you're charging everybody less?
Right, so to that point, most direct primary care practices, I'll just go into the math a little bit more for you. Most direct primary care practices charge a monthly fee that's between $50 and $150 per member per month. And if you think about the last time that you went to the doctor and you had to pay your copay, and then you know, you got a bill 3 months later for the rest of the 99213, 99204, whatever it might have been, that was probably around $150 for that. So when we think about the cost per member per month, it's usually between that $50 and $150 per member per month. And with that, we can have a really small staff. And so when you do the math on that, it's actually not that hard to be financially successful when it's me and my nurse and my office manager. And so instead of having 7 employees per clinician, we're able to dramatically cut down on our overhead. We're in a smaller space. Some practices do entirely remote or home visits or a shared office space. So it's really about maximizing what we're able to offer while keeping our overhead low. Yeah.
What worked best for you for patient recruitment?
What worked best for me for patient recruitment? I mean, the nice thing is our patients feel really well cared for and taken care of. And so as a pediatrician, we like new babies, and we like having new babies join our practice. And when people are looking for their pediatrician, they're asking their friends, they're asking on social media or their friend groups or those sorts of things. And when they say, we come and do home visits, and you can text all of your random questions, even if it's 2 in the morning. Like I tell parents when we're talking with them about how it works with the text messaging is you're gonna be up feeding your baby at 2 in the morning, and if a question pops into your head, you don't have to put it in your Apple Notes and save it for your next visit. You can just text me. I'm not gonna see it at 2 in the morning, like it's not gonna wake me up, but in the morning I'll look at my messages and then get back to you about that. And so providing really good care, helps to just get more patients in. We use social media, we use in-person events. So one of our biggest events every year in the new baby world is there's a baby expo where, expectant parents come to see baby crap and learn about babies and get more baby crap and free swag and all those sorts of things. We go there, we give out books, we talk with parents about what they're hoping for in their pediatric experience with their baby, and that's a main driver for our new patient signups. Yep.
I'm a emergency medicine, so I was thinking about risk and liability. From a medical legal perspective, in comparison to a standard practice, I would assume something like this would actually lower your risk because people are happy with the care they're receiving, right? And you also develop close relationships, I assume. Do you have any insight into that?
I was hoping that you would assume the opposite, that it would be more expensive because we're providing care over text messages and all those things, because then I was going to say, no, you're wrong. It's actually more affordable from a liability standpoint, but you nailed it on the head. Is that one, so his question was about medical, legal, and malpractice insurance and those sorts of things. When I when I told them, hey, malpractice, I'm switching to a direct primary care model, they said, oh, great, great for you, great for me. Your premiums are going to be a lot less. One, because we know your patient panel will be a lot smaller. So my patient panel went from about 2,500 patients just attributed to me to we now have 600 or so. And we know that you're going to have closer relationships with them, so we're going to give you a discount on your malpractice because the risk is so much lower with direct primary care. So that is a cost saver for us too. Yeah.
So you don't bill any insurance?
We don't bill any insurance. What we do is we use their insurance, and this is kind of how I frame it to parents because, they're paying their insurance premiums anyways, and they need insurance for all the other healthcare episodes that they're going to have, and if their kid, breaks their arm or has appendicitis or anything along those lines. And so we use your insurance for the big stuff: lab, radiology, vaccines, referrals to specialists. But for the day-to-day stuff, for getting your baby weighed, for coming in about their rash, for text messaging about their baby poop, we don't use your insurance for that because it would just cost you way too much. And so we just charge a membership fee that covers everything. And so that's how we pair the insurance that they're already paying for, because they already are paying for it. And there's not really a good way around that for families. Like 98% of our patients have commercial or Medicaid insurance. That's how we use their insurance so that they still get the benefit from it, especially for vaccines. Vaccines are the most important and most expensive thing that we bill insurance for because vaccines are just wildly expensive without insurance. Yeah.
How do you go about referring to that next phase if it is something big, or the big stuff, as you said?
Like every other office. So like if I have a patient that needs to see a gastroenterologist, we just send a referral. There's only a couple of specific insurance plans that require somebody that is in network to actually generate that referral, at least in pediatrics. And so we're able to kind of work around that when we need to, but it isn't a big stumbling block for us.
Can I ask a follow-up?
Of course.
It's so good to have DPC as the starting point, and it's like a shame if the next part has to go back into a big health system.
Yeah.
So are you mindful about trying to steer imaging and x-rays to independent labs or use independent labs?
Yes, absolutely. And the nice thing, I don't know if you all know this about Lincoln, but Lincoln is kind of a private practice haven in the country where probably 80+% of our primary care and specialty care and imaging and all those sort of things are private practice rather than hospital owned or big corporation owned. And so when we say we need an x-ray, hey, here's the 3 options. This one is the cheapest and it's right around the corner and it's private practice owners just like us. A lot of direct primary care, especially in the adult world, will partner with labs to get reduced costs for those labs and imaging as well. We just don't order enough lab and we don't do enough imaging on a regular basis that it makes sense for us to do that. But a lot of family practice or internal medicine direct primary care will partner with labs and imaging facilities to get reduced costs for their patients. Yep.
Have you tried it with success in selling employers on membership?
patients?
So not in pediatric care. I've tried in pediatric care, but I haven't been successful because employers want to cover their employees, not just their employees' kids. It's a nice fringe or perk if you were to say, hey, we got healthcare for your kids. I haven't had any success in that. I've tried a little bit, but I know in the adult world in direct primary care that it is wildly popular to have an employer partner with direct primary care, like Todd, and be able to offer employers that for their employees.
Well, thank you everybody for your questions.
Thank you all.